I am Ilona Velarde and today I'm interviewing Dr. David Dighton, a London and Nicosia-based cardiologist. Welcome, David.
Nice to be here.
Today I would like to ask you about the blood pressure. What exactly is blood pressure?
It's a good question. I think many people use the word blood pressure. They don't really understand what it is, I guess. If I can keep it simple, I will. As the heart beats, it pushes blood forward and the pressure rises in the arteries. It reaches a peak, and that peak we call the systolic pressure. And then the heart fills and relaxes, and then the blood pressure drops. And that low level we call the diastolic pressure. So a person can have a blood pressure of 120/80. The 120 is the peak pressure, the 80 is the resting pressure.
Where do these figures come from?
Well, originally this pressure was measured in animals, and it was measured with a column, a tube of mercury, because it's very heavy metal. And if, let's say, you have a blood pressure of 120, what that means is a column of mercury 120 millimeters high. So in other words, 12 centimeters of mercury. And the 8 is the same, that would be 8 centimeters of mercury. To give you an idea of how much pressure there is. The way you can realize it in real life is if you had somebody with an accident and they had an artery bleeding, it would actually form a little fountain because it would have to reach that pressure as it comes out.
And what problems does blood pressure cause?
Well, the low blood pressure is a problem for some people. That causes or can cause fainting or a predisposition to fainting. They pass out, they go pale, they feel sick, they start to sweat, and they have to lie on the floor, and their blood pressure then is very low. It could be something like 60/30 or something like that. So low blood pressure has symptoms. High blood pressure does not cause symptoms at all. People think that it causes headaches, but it doesn't really. But high pressure is a real problem because it can cause strokes. That's its main final outcome, a stroke. So we want to lower pressure in order to prevent strokes. But before that happens, you may not know that you've got high blood pressure.
A lot of young people faint. What can they do?
Well, they can get fitter, or they can eat more salt. If they genuinely have low blood pressure, and if it really is a problem, fainting, then salt can help to keep the blood pressure up. I must say at this point that, of course, with high blood pressure, salt makes high blood pressure worse, so you have to be very careful. But in fainting, it mainly occurs due to low blood pressure and low salt intake, because very few people eat much salt these days. There are a few occasions where fainting, of course, is limited to travel sickness, pregnancy, and so on, where there are other forms of treatment. But basically, most people need to exercise more and to have perhaps a slight increase in their salt intake.
Please tell me about high blood pressure.
Well, high blood pressure is a bit contentious because cardiologists and doctors in general argue about what high blood pressure is. If we go back 30 years, we would have said anything over 160 at the top pressure and anything over 95 on the lower pressure. Now I think the world consensus is that we don't really want it to be above 140, the higher one, and 80 or 85 on the lower one. So high blood pressure actually comes from the arteries, the small arteries, which are about 1 millimeter in size, becoming narrower. And the heart finds it difficult to push the blood through these arteries, and therefore the pressure has to rise as a consequence. So that's what high blood pressure is. And it's the consistent high blood pressure that we're really after.
And does blood pressure vary much?
That's a good question, because blood pressure varies all the time. It's highest before you wake up in the morning, we believe. And then it even varies a little bit with breathing. It certainly varies with anxiety. So the question is for doctors, what is high blood pressure? How do we define it? Because in anxious people it can be high, that's not necessarily true high blood pressure. When you're asleep it could be low, and it can vary with stresses throughout the day. So The real question is how can we really be sure that somebody has blood pressure that needs treating, because it does vary so much. We can do blood pressure monitoring, but that only measures it every half an hour. Because the heart beats so many times in a day, let's say 60 beats a minute, there's about 80,000 blood pressures every day, and each of them may be slightly different. So we usually try to take an average, and if the average is high, we then sometimes feel that blood pressure needs treating.
What are the side effects of the blood pressure within the body?
Well, there are quite a few, but the main one is a growth of muscle, heart muscle and artery muscle, because arteries are just little tubes made of muscle. And we can pick this up in various tests. Going back a few years when we used chest x-rays a lot, you could see that the heart was bigger on a chest x-ray. The heart was more muscular. In the eye, opticians who examine people will find that the arteries look different. They look thicker when they're pressing on the veins. And in the heart itself, if we use an echo sounding device, we can see that the muscle walls are thicker. Now these changes, if they occur, mean that the patient definitely has treatable high blood pressure. You can't be as sure as all that by simply taking the blood pressure, but once you find side effects, if you like, or the effects of blood pressure, then you know it's serious and needs to be treated. Let me show you what an echo sounding machine looks like. It's quite simple. It's a little microphone that goes on the chest and shows the heart with its thickened muscle. And also, in this illustration on the right is a heart tracing, an ECG. And with high blood pressure, what we see is bigger voltages. So the heart tracing actually looks taller and more muscular, if you like.
Is it dangerous, a bigger heart?
In itself, no. It's just the effect of blood pressure. We don't worry about the fact that it's big, we just use it as a means of saying somebody needs treatment. What matters more is this thickening of the little arteries all over the body, actually, in the kidney and in the brain. Actually, in the brain, the arteries don't become thicker, they become thinner. And it's because they become thinner that they burst, and that can cause bleeding in the brain, which is basically the commonest form of stroke. I'd like to show you a cross-section of the heart on an echocardiogram, just to show how easy it is to see the thickness. Now in this illustration, on the left is where the heart is filling, and on the right is where it's contracting. And you can actually see a rim of muscle which is dark grey in colour around it, which we can measure, and it's that we measure when we're defining whether the heart is enlarged or not.
Why does arteries become thinner in the brain?
Well, mainly because there's not enough space for them to become thicker. The brain is a very tightly filled, well, the skull is a very tightly filled box, and the brain more or less fills it. So if the arteries were to increase in size, there wouldn't be enough room for the brain. So actually they tend to thin. I mean, that's a bit of a naive answer, but I think that the most important thing is that they do thin. We're not entirely sure why, but they do, and they become more fragile, and of course they can burst more easily with high blood pressure.
So how can a person be sure that they need a treatment?
Well, it can be difficult. I mean, the real problem lies before the patient develops a thickened heart muscle. If they develop a thickened heart muscle, then you can be absolutely sure that they need treatment. So patients must ask their doctor, has it affected my heart? And if it has, they need treatment. The problem is before that occurs. So I usually get my patients to take their own blood pressure under different circumstances. We can also do blood pressure monitors. We can put it round their arm and it takes it every half an hour. But I rather like my patients taking their own blood pressure under different circumstances.
David, what do you mean different circumstances?
Well, when you're making a film like this, would be a good occasion to say it makes people anxious. And so this is a circumstance where maybe the interviewer might have high blood pressure if it was in her family, so maybe you should get tested. But I like to get my patients to test it when they're relaxed. I like to get them to test when they're angry, maybe in an office if they're frustrated, and when they're anxious. because these could have very big influences on their blood pressure. It might make a difference as to whether we treat them for blood pressure or for anxiety and anger.
Do you need any more information about the patients?
Well, I like to take family history because it puts it into context. If the patient's mother or father had high blood pressure, then the chances that the patient has it too are about 1 in 4. If both parents have had high blood pressure and they had, let's say, theoretically 10 children, then 8 out of the 10 children would have high blood pressure as well. So you can almost anticipate that the patient is going to get high blood pressure. That's one thing. The other thing is blood pressure affects kidneys. So we want to know about kidney function. We usually get that from urine tests and a blood test for creatinine, it's called, which gives us an overall idea of how well the kidneys are functioning.
Many people get a high blood pressure only when they are anxious and no other time. How do you handle them?
Well, it's difficult for a cardiologist to handle them, but we might refer them for counselling if they have a stressful problem. We might refer them to study yoga. There's been quite a few studies of how yoga lowers blood pressure. Then there are, of course, tranquilizers used appropriately by people that understand these things, and so on. But it's not an easy thing for most doctors to handle anxious people unless they specialize in it.
Is anxiety-related blood pressure dangerous?
Well, I think the simple answer is no, but of course it could be the very first sign of inherited blood pressure. So what I do is to do baseline tests on them, tests which I can use in the future to see if there are any changes, and sometimes I'll ask them to come back in a year or so to recheck them, because we can't be sure whether it's dangerous in everybody. But the answer to your question is probably not in most people.
So how do you treat a high blood pressure?
Well, once we've confirmed that it needs treating, because remember it is lifelong treatment, so you need to be sure that you've truly got high blood pressure, then I think probably the most important drug is something called an ACE inhibitor. This is something that stops the adrenaline-like compounds developing in the artery wall. And there's another drug, they all end in sartan. So there's candesartan and losartan. These are drugs which have almost no side effects when they're taken. They're taken once a day, and they stop the heart getting thicker, and they stop the arteries getting thicker as well. So they actually prevent the process which causes high blood pressure. That's why we like them so much. Years ago we used to use diuretics. They're pills that make you pass salt in your urine. And there are a few people that might need that, mainly women who are retaining fluid, but by and large they're not that much useful anymore.
Is just lowering the blood pressure good enough on its own?
Well, it's an important thing to do, obviously. We want to bring the blood pressure down under 140/80 if we can at all times, or most times. But I like also to make sure that the heart isn't growing in time. So for me, successful treatment has two arms to it. One is lowering the blood pressure to a reasonable level, and over the years, making sure that the heart and arteries do not progressively get thicker, hypertrophy we call it. And once I can be sure that the heart is no longer growing, then I'm happy that we've got patients on the best treatment.
So heart muscle thickening is very important then?
It is. Going back many years when we used to see, when we used to do chest x-rays and we saw a large heart, those particular patients quite often had strokes. So in my mind, this thickening of the heart muscle is very strongly associated with side effects and with stroke. So it's something you don't want to develop if you can avoid it, and that's why the modern medication which prevents it is so important.
Just out of interest, is drinking a wine good for blood pressure?
Well, the World Health Organization recommends 1 glass of wine a day, and that would be safe in high blood pressure. But I have to tell you that I've seen quite a few patients in the last few years who have high blood pressure only because they drink a lot. And I've found this out because I've got them to drink less, and strangely their blood pressure has become normal. So I've proven that their overuse, their over-drinking, is actually the cause of their blood pressure. But to come back to your question, I think 1 glass of wine a day is definitely not dangerous, and probably 2. And if people are anxious and it relaxes them, that's got to be good.
If you have a high blood pressure, is it good to exercise?
Well, it can be dangerous. We like to prove whether it is or not. So in my practice, I always treat people with the drugs I mentioned before, and then I actually put them on a treadmill exercise test machine to see what their blood pressure does. If we've got perfect control, then their blood pressure won't be too high on exercise, and that's the criterion I use. They have to be able to do an exercise test with fairly normal blood pressures before I tell them that exercise is okay, because exercise really can raise blood pressure a lot, and I suspect it can be quite dangerous, especially in the untreated cases, or cases that aren't treated as well as they might be.
Should everyone with a family history with a high blood pressure to get checked?
Well, I think they should. I mean, nowadays you can walk into a pharmacy and get your blood pressure checked. Your GP's practice nurse might do it for you, but just occasionally keep an eye on it, because remember, the chances of high blood pressure with a family history are at best 1 in 4.
Can patients contact you about this?
Yes, you can contact me through my website and email. We have a Cypriot website, which is heartsense.com.cy, or the English one is thecardiaccenteruk.co.uk, and my email address is there. So you can contact me in many ways, but the contacts are all there. And after this interview, you will see a caption with the contact details as well.
All that remains is to thank you for watching and for Dr. David Dighton coming to help us understand about the blood pressure.
Thank you for asking me.
This is Ilona Velarde saying goodbye for now. And please note that our other videos explains about other heart symptoms. If you would like to have more information about this subject, why not buy or download our Heart Sense book, which is easy to read and contains useful information about the heart and the best diet to eat. In case you would like to read something more technical, you can buy our Eat to Your Heart's content book from our websites. And you can also download this very short brochure, Worried About Your Heart, which explains many details about heart problems and which is available in 4 languages: English, Greek, German and Russian. Don't forget to purchase our Heart Sense supplement, which is essential to even the best diet. Soon we will also have Heart Sense tablets, which will be available on our websites. All our products and information are available on our websites, heartsense.com.cy and thecardiaccenteruk.co.uk.